This is a standing pelvic x-ray weight bearing. This is the client that we filmed showing pelvic hypermobility on the left side. When he was 6 years old, he fractured his left hip. He started to have, in his adulthood, progressive SI area pain, low back pain, and some hip pain. And that's what prompted this x-ray. Now, he could be standing asymmetrically, so you'll see that this ilium looks more narrow than this one. If we could measure it across, I think you can especially see it looking at the top of the ilium compared to this one. This one is just simply, this brim is simply wider. Some people would say, oh, that means the ilium moved on the sacrum and it's stuck and it's in the SI joint and all this stuff. And no one knows that. You cannot make that kind of a discernment with an x-ray. There's some nice research that'll validate what I just stated. You can image a little bit of the SI joints. However, here it's obstructed with bowel, and you can see a little bit of it down there. One could say there's a hint of it being a little bit wider here. There is that possibility. Truth be told, it takes a CAT scan, not an x-ray, to really visualize the SI joint. And there are some studies that will talk about a certain angle with an x-ray, but no x-ray in one or two views shows the entire breadth, length, depth of the sacroiliac joint, and that's a fact. What caught my attention was the symphysis pubis. For a 34-year-old stocky, muscular male, I would expect the symphyseal width at the mid-body to be about 2 millimeters, and it clearly is 5 millimeters. So that's a rather fascinating finding, and you can see I'm spot on. That is 5 millimeters. Okay? Now, he had to get a scope on his left hip and look at it right here. That missed my first glance. Look at that strange phenomenon, like a fracture along the most lateral margin that must have healed. And when he was a child, you know, these three bones were not coalesced. They were not, the hemipelvis was not fused. I'm going to guess that an x-ray could not visualize it at that time. Reasoned thinking would tell us that this in fact happened when he was a child, when he was 6 years old skating, and a very large person fell backwards onto him, fractured the femur. I don't see where the femur was fractured. Maybe I would guess that it's lower, you know, that it's below where you won't see it. But if you look on this side, this is the femoral head right here, sitting inside the acetabulum. Okay. And if you look at this side, and when I first started looking, I focused on that, and then I looked at the heads, you know, and I kept thinking, he's got to have some problem with the heads of the femur because he had a scope of the hip. And I'm looking here, I'm saying those are clean, all the while missing all this, okay? Well, this x-ray predated the arthroscopic surgery to this hip. And what you see is this lip here of the acetabulum, that jagged area that was in fact impinging into the joint space and causing him some pain. I'll show you some real quick pictures of the joint surgery of the scope. But the main point I wanted to make was that in a 34-year-old male who is a very stocky, muscular individual, I would never anticipate seeing a 5 millimeter width of the symphysis pubis, and this really supports my contention that he does in fact have pelvic hypermobility / instability. And another thing that hints at it is perhaps a wider joint space on this side. Now this one's, you know, obscured. You can hardly see a little bit down here. But if you compare this lower margin of the SI joint here with this one, This one really does look wider, so it'd be nice if we could get another view, and really a CAT scan with 3D reformatting would be just fabulous. Now here's another x-ray of the same, you know, it's late at night, I'm tired, I can't remember what they call it, you know, frog leg view or something like that. But here you see again, the head of the femur is gorgeous, okay? I hope mine looks that good. And this is the cartilage here, and then this is all bone down yonder. I'm not sure how to interpret that. I'm not trained in radiology. I've taken just one class in a very brief class. But up here you see that jagged old fracture that's probably solid, filled with fibrous tissue. And then over here you can see the arthroscopic surgery to that hip. But basically there's no detail here that we need to see, and I'm done now. So the point was the symphysis pubis. Thank you.